Hi, my name is Allie. Can you tell me your name?
Sophie.
How old are you?
16.
Okay, I'm going to be doing a head, face, neck, eyes, ears, nose, lips, and mouth assessment. I'm going to start with your head. I'm just palpating, checking for any lumps, bumps, or bruises. Any tenderness noted?
No.
Okay. Your hair is nice and clean and brown. No dandruff or lesions noted. Very good. Now I'm going to move on to your face. I'm checking facial nerve number 7, which is your facial nerve. Can you smile for me? Frown. Puff out your cheeks. Very good. Now I'm assessing your temporal arteries and your cranial nerve number 5, which is your trigeminal. Can you open your mouth? Close it. Now clench your teeth. Okay. Now I'm assessing your sinuses. I'm going to start with your frontal sinuses and your maxillary sinuses. No tenderness noted when I do that. Okay. Now I'm going to move on to your neck. I'm checking your trachea. It's nice and midline. No bumps, lumps, or bruises noted. Can you get in front of me? I'm feeling your thyroid gland. Note for any abnormalities. Okay, very good. Now I'm going to be assessing your lymph nodes. There's 10 of them. I'm going to start with your preauricular, your postauricular, your occipital, your submental, your submandibular, your jugulo-digastric, your superficial cervical, your deep cervical, your posterior cervical, and can you lift up your supraclavicular? Any tenderness noted when I do that? Okay. Now I'm going to move on to your eyes. I'm going to be assessing cranial nerve number 2, which is your ocular nerve. Can you tell me what this says?
Alcohol prep pad.
Okay. Now I'm going to be assessing cranial nerve number 3, 4, and 6. Number 3 is your ocular motor. Number 4 is your trochlear, and number 6 is your abducens. I'm going to get you to follow this without, just move your eyes, not your head. Very good. Now, can you look at this and look at the wall and back at my light? Very good. Now I'm looking at your conjunctiva, which is nice and pink, your sclera, which is nice and white, your iris, which is nice and green. Can you turn to the side for me? Your cornea is nice and round, no drainage or irritation noted. Now I'm going to move on to your ears. I'm checking for any tenderness when I do this. Okay. I'm going to be assessing cranial nerve number 8, which is your acoustic nerve. I'm going to get you to hold one side of your ear and I'm going to whisper something.
Basketball.
Now hold the other side.
Football.
Very good. Now I'm moving on to your nose. I'm checking for symmetry. Your nose is nice and symmetrical. Can you hold one side? Okay. Now hold the other side and sniff. Now close your eyes. I'm going to be assessing the olfactory, which is your sense of smell, and tell me what you smell.
Alcohol.
Very good. Now can you lean your head back? I'm checking your nasal mucosa, which is nice and pink, your septum, which is nice and midline and symmetrical. Very good. Now I'm going to move on to your lips, which are nice and pink. No cracks noted or lesions. Can you open your mouth for me? I'm checking your teeth, which are nice and white, no decay noted. I'm checking your gums, which are nice and pink. I'm checking your hard and soft palate. And can you open your mouth? Your buccal mucosa, which is nice and pink. Can you stick your tongue out? Your tongue, which is nice and pink and moist. And your tonsils. Okay. Now I'm going to move on to cranial nerve. It's number 9, 10, and 12. Number 9 is your glossopharyngeal, and number 10 is your vagus. And number 12 is your hypoglossal. I'm going to start with number 12. Can you say the words light, tight, dynamite?
Light, tight, dynamite.
Very good. Now I'm going to move on to 9 and 10. Can you say ah?
Ah.
Okay, very good. And this completes our head, neck, face, eyes, ears, nose, and throat assessment. Today we did a head, face, neck, eyes, ears, nose, and throat assessment on a 16-year-old female. We started at her head where we assessed any lumps, bumps, or bruises. She denies tenderness on palpation. We then moved to assess her hair, which was nice and brown, No danger for lesions noted. We then moved on to her face, where we assessed cranial nerve number 7, which is her facial nerve, and cranial nerve number 5, which is her trigeminal. We then assessed her temporal artery, and she denies tenderness. We then moved on to her frontal sinuses and her maxillary sinuses, and no tenderness noted there either. We then moved on to her neck, where we assessed her trachea, which was nice in midline. No lumps, bumps, or bruises noted. We then assessed her thyroid, which was nice and not enlarged or tender. We then moved on to assess her 10 lymph nodes. We then moved on to her eyes, where we assessed cranial nerve number 2, which was her ocular nerve. We then assessed cranial nerve number 3, 4, and 6, which is her oculomotor, her trochlear, and her abducens. We assessed her conjunctiva, which was nice and pink, her sclera, which was nice and white, her iris, which was nice and green, and her cornea was nice and round. No irritation or drainage noted. We then moved on to her ears, checking for any tenderness. She denies tenderness. No drainage noted. We assessed cranial nerve number 8, which was her acoustic nerve. We then moved on to her nose, where we assessed symmetry, and cranial nerve number 1, which is her olfactory, her sense of smell. We then assessed her nasal mucosa, which was nice and pink and moist. No irritation or drainage noted. Her septum was nice in midline. We then moved on to her mouth. Her lips were nice and pink and moist. No cracks noted. Her buccal mucosa, which was nice and pink and moist. We then assessed her gums and her teeth. Her teeth were nice and white, no decay noted. Her gums were nice and pink and moist. Her hard and soft palate, her tongue, and her tonsils, which were all nice and pink and moist. No irritation noted. We then moved on to cranial nerve number 9, 10, and 12. We started with cranial nerve number 12, which is her hypoglossal. We then moved on to cranial nerve number 9, which is her glossopharyngeal, and cranial nerve number 10, which is her vagus.